Welcome to another Founder Wisdom podcast. We have Assaf Barnea with us today. He's a managing partner at Sanara Capital and Sanara Venture. He's a chairman at Israel Export Institute, Life Science Board, and also former business consultant at the World Bank and IFC Venture Capital team. He's a global speaker in Israel, also a seasoned entrepreneur. So today we're going to talk about his background and everything he's been up to. BookRightGPT.com is presenting this podcast. You want to take your LinkedIn posts and convert them into a Kindle book in 5 minutes. You can go to BookRightGPT.com. The first credit is on me. Assaf, welcome to the pod. Tell me a bit more about yourself and what you're up to nowadays.
Well, basically, I'm based in Tel Aviv in Israel. We're looking for truly exciting times in the healthcare industry, medical transition that started to happen some years ago in digital health, but somehow got the ups and downs, typical process of bringing in innovation. But I think overall, and I assume that will be one of our topics to speak about medical and healthcare innovation. So an AI, which is quite related to that, we're expecting to see a lot of opportunities parallel to whatever the trends that are happening now in the VC community, down rounds in some opportunities that we could not foresee before, but also the burden on us as VCs to shape our model and make sure that we provide value to the entrepreneurs.
Yeah, you started in medtech. It seems I see like Cardio Sense in there. Then I see it, Kinrod Venture, then the World Bank. What prompted you to start a business? I mean, you're in the business of startup land in Israel. So a lot of people start tech businesses, especially in the medical biotech sector. So what got you started?
Well, I did play professional basketball for 14 years. I played college for Seton Hall, winning the biggest championship. The first time Seton Hall has won the biggest championship in the Madison Square Garden, beating Georgetown with Alonzo Mourning, Dikembe Mutombo. So this was truly an experience. And then after I went back and I played as a professional altogether for 13 or 14 years. Parallel to that, I did 3 degrees. I did law school, I'm a lawyer. I did business school, and I did political science and psychology. So that actually had set the ground for me to, when I left the game of basketball after being a professional, to move into to become a lawyer, but one that does not want to practice law, and then started in the telecom industry in Israel in one of the flagship back at the time, a very known company called Converse. Back at the time, the largest voicemail manufacturer worldwide. And then after I moved to be a clean tech investor, while parallel to that being a medical device entrepreneur. So that had led me to really focus on life science. Whatever I did for the last 15 years, 20 years, I would say, is VC investment on one side and innovation platforms, global and local innovation platforms with the World Bank, with others that are all focusing on life science technology, biology and physics and what have you, electrophysics, and now definitely software and AI, which is stepping in quite impressively.
Right. And why health specifically? Israel's a nice place to do that, but did you always have a mission to sort of save or improve lives?
It may sound generic and redundant to say that, but it's. I think there's something which is a little bit that it touches everybody. I mean, the moment you take the veil, you take the day-to-day and the screen that we all put on ourselves while doing some other stuff. I'm looking personally at something that could really touch people on one side and help people on one side, but also there's a true beauty, there's a true dance in the healthcare industry, which is not just the multidisciplinary approach, biology and physics and chemistry and electrophysics and whatever it may be, and software and anything that you see the trends, but it's something that eventually when you bring an innovation to the marketplace, and Sanara has started as an early stage, seed stage vehicle supported by Philips and Teva, actually a joint venture of Philips and Teva, investing the first $1.5 million. This is actually 10 years ago. So when you take a company and eventually you bring a company with $20-30 million, it's like a marathon. You've been running and going through the ups and downs, but eventually when you get into the stadium, you feel so very proud of being able to go through those ups and downs, like in sports, by the way, and make sure that you bring a company and a new technology to the marketplace. That's the beauty in life science innovation, in healthcare innovation specifically.
Yeah, it's a very long marathon, and the exits are pretty big, but so are the investments, right? And the capital injection. That's why like you cannot build this bootstrap. You need to absolutely raise. Were you always in sports? Why did you choose basket? And also, why didn't you make a full career out of it?
Well, I did play. I started to play basketball at the age of 8, actually, without knowing that I'm actually starting my professional career at the age of 8. I'm now talking to my two sons, one of which is playing football or soccer, and the other one is playing basketball. And the same discipline that you need to deploy basically when you start the game is something that later on, without knowing it, becomes your personality, and then it escorts you to be a VC that doesn't give up, or a VC that would like to overcome challenges and bad times, injuries, and stuff like that. So when I started the game of basketball, it was some kind, not even a dream. It's maybe something that I should not be saying, but basically it was something like obvious, something that I will be doing. And eventually I did find myself playing till the age of 31, out of which 13 or 14 years as a professional, and going through ups and downs of injuries. I tore my ACL in my knee for like 2 times. I had to go through reconstruction in the hospital for special surgery in New York for coming back, which is a tough surgery, and you have to go back quite cautiously, because it's quite a painful return. But it's the ability to overcome those and to overcome the disappointments and the challenges and the fact that you've been thrown away from the team and you need to come back and work on your own. And so many people are skeptics about your ability to be back as a professional basketball player and to go back to the same level of playing ball as you used to. So you have to fight those skepticism, the fans, the management team, even your teammates to some extent, which are saying, he was thrown away from the cycle of the team. So somehow, I would not say even luckily, but I had to go through those as a fact. And I think that had built some kind of capabilities that today actually I'm implementing them in the VC community as well.
Interesting. Yeah, that's what I was about to ask. You competed heavily in the startup world, but now that you're VC, do you still feel that you're competing now that you're not necessarily like in the arena, but more in the stands?
No, actually, no. I think that we're right on the main court. Actually, we are, capital and money is actually controlling the VC community. And we are standing in the middle of the court. We can take the shots if we want, 3-pointers or 2-pointers or layups, it depends. But it's really the way that we do business today in Sanara Capital, the second fund of Sanara, which is deploying, we deploy $3 to $4 million in A-rounds companies, in digital health, in medical devices, and in bioconvergence technologies, which we can elaborate a little bit. What do we mean by bioconvergence? But I think that, the fact that we are able to deploy capital and to help companies fundraise and potentially to restructure some processes and help them on the board level, help them with strategics. We have, aside from Philips and Teva, whom I mentioned before, I've built, and I'm saying I'm passionate, and sometimes I'm even saying that I'm more than passionate, I'm obsessed with knowledge sharing and being someone that truly wants to know and feels that I don't know enough in any given point almost. I've built an advisory board of 120 people globally, Charles. This is, sometimes people are teasing me and say, hey, Assaf, how do you manage 120 people in your advisory board? And I'm saying, well, it's on domain expertise. It could be degenerative diseases like Parkinson, whatever, Alzheimer or others, MS and others, or it could be on the cardiovascular side, or it could be on geography based, not necessarily on the domain expertise of those advisors in Europe, in the States, of course, in Latin America and in Asia. And I think, by the way, this is unlikely or not as typical to Israeli companies, which typically focus on the US market as well as on the European market. But being with the World Bank and being also the chairman of the board of the Export Institute for 9 years now in Israel, I feel that we need to open up and be able to go through knowledge sharing with others, strategic partners and investors and VCs. So going back to your question, in terms of competition, there's always competition between us as VCs fighting for the best deal. Sometimes you want to be in that deal. Sometimes you see other companies going through an exit, and and you feel like, oh, you wish that was you making the investment at that point of time. So there's always competition, but I think where we are today and what we convey as Sanara is really to be able to speak and communicate in the same level, that eventually trying to maintain the win-win proposition. Otherwise, if you're trying to be too aggressive on the startups, if you're trying to be too aggressive to other VCs, whatever, you cannot make it. So it's like a team play. It's like basketball to that extent. It's not necessarily tennis, and I'm not putting down tennis at all. I'm just saying, as a team player, you have to bring them into the loop. You have to make sure that everybody somehow synchronize and dance to the same path and to the same strategy of a company, and not necessarily forcing yourself to be the winner and the only winner.
Right. And what was your track record as a medtech founder? Did you had a couple of exits, and what lessons did you take from you as a founder to you as a VC today?
Well, the number one take that I typically say when I'm speaking in conferences and others is to listen. Apparently, and maybe that could be typical to some Israeli entrepreneurs more than the others. But I think that so many entrepreneurs that we encounter do not listen carefully, and do not listen to the vibes of your board, do not listen to the vibes of your investors or shareholders, do not listen to the marketplace, do not go through a product market fit, which eventually will avoid them for pivoting and looking for another $7 million or $10 million just to survive and to take a technology to the marketplace. I think that the inability to listen actually brings in another sense, which is blindness. So if you don't listen well, you don't see well. And this is something that we truly, as an industry, the ability to communicate and to go, as I mentioned before, through knowledge sharing platforms, and not just to meet in conferences. This is one way, like the example that I was given about this global advisory board of 120 people. We can talk to folks in Latin America. We can better understand as Israeli VCs investing in companies, what might be a business model in the digital health space in certain payers, providers, situations in the US. So this is so important to learn from one another in the industry as a whole and to take it to the next level.
Since COVID happened, did you had to pivot? How did that change your investment strategy?
I think COVID was truly something that we need to look back again and again. I don't think we have, gone through the analysis of what happened. But if I'm trying to make the best, evaluation of what happened, is mainly related to digital health and telemedicine. I mean, it makes sense. I've been in meetings in India with the World Bank, and I've been in meetings in Boston with the largest providers in the US, talking about the vision of telemedicine, enabling on one side in growth markets like in India, the accessibility of basic medical care and primary care services, which other people cannot afford it just because they're living 800 miles away from any decent hospital, right? So that could have been a dream on one side. On the other, if you're looking into traffic jams in Boston, traveling in Boston and just you want to take your blood test, you have to go through two hours of driving and going to traffic jams, and you say, oh, what the hell? So if you could do some of those exams, physical exams and others, and provide services to communities in rural areas through telemedicine, this was one of my biggest hope and one of my biggest, I would say, disappointment. Because initially we saw before COVID, 2, 3, 4, 7% maybe of people were using telemedicine before COVID. While COVID took place, we saw a rise of like 40 to 50%, an uptake of tremendous amounts. And we as investors at the industry have been hoping to see that going back to 20% usage, 15% usage, but it has not. And more so, the valuations of companies went down, and the services had to go through reshaping again and again. So I think it's okay. It's eventually something that we have to go through and make sure that the business model, the flow of capital in digital health, which is still a big promise, also for us as investors, there's so many opportunities in the marketplace. I can give one or two examples of our portfolio companies just to illustrate what we can do with even Israeli companies setting up a business model in the US and being able to address a US market need and being very successful. I can talk maybe about two companies, not telemedicine related, but digital health related, of course. One is a company that we invested from day one called TaylorMed, which is a US-based focus, about 100 people now, working with like 900 providers in the US and with the largest pharma companies that you can think of out of the 10 companies that you may indicate. TaylorMed is providing services basically in optimization to out-of-pocket expenses for cancer patients and other chronic disease patients who cannot afford to pay the 20%. The company started in Sanara Ventures in our incubator and was also supported by Sanara Capital, our post-incubation fund. And we had investments from Providence in the US, from Citibank and a few other strategics and a few other providers as well. And basically becoming a company of 100 people now, providing services to millions of people in the US and actually becoming the largest affordability platform in the US today. And this is an Israeli-based, or started as an Israeli-based company, but acknowledging truly a market need in the US and becoming the largest affordability platform today. We allow people to see, and we allow the hospitals as our main customers to be able to provide services of understanding, if there's other pockets that could be shifted and helping the patients who cannot afford to pay the 20%, saying a woman, unfortunately, at the age of 40 was diagnosed with cancer. She has 2 daughters and she cannot feed her daughters, while on the other, she has to take the therapy and the medicines. And in so many cases, it goes down into what is called financial toxicity, the stress that people get into because their inability to pay their debts. And that actually also on the provider side, which today they do provide the services to so many people in the US, but unfortunately, after a few months, cannot collect the money. So they're losing, Charles, on a yearly base, they're losing $40 billion in the US market. So actually, TaylorMed goes into that gap and basically address and build a bridge between the payers, the providers, and the patients, of course, and allowing to offset between the patient pockets to other pockets and becoming this network that I've mentioned before. So this is something that we're very, very proud with such a company. And another is actually touching another market in the US, which is basically a company called Profility. Profility is actually looking to optimize and basically automate the process of releasing patients from the hospital to a rehabilitation center or a nursing home, which typically may take a few days till rehabilitation centers and nursing home make a decision whether to accept or not to accept the patient. Say the patient is suffering from orthopedics issues or dialysis or whatever, they may not or should not take any patient. And that typically takes a decision. They get dozens and dozens of pages, and eventually they need to make a decision, an accurate one. So Profility is actually summing up all of those processes into a one-pager, as the name comes from, and basically allowing those rehabilitation center and nursing home to make a much more faster decision and a more accurate decision whether to accept and not to accept the patient, but also helping the hospitals, the providers, to release the patient in a more effective ways. So not just the US market, these 2 examples of our companies, our portfolio companies in Sanara, are just examples of digital health, I would say, potential and capabilities of looking into those broken models of the accessibility to medical care or the financial inability to pay or whatever it may be. And then again, not just in the US, and coming up with those must-have technologies. And this is why I'm still a great believer and a great supporter of digital health, despite the fact that we have not seen huge exits yet. But this will shape up, and this will be definitely coming up in the next 5 years.
Right. So what does a day-to-day in your life look like? At what time do you get up? What habits do you nurture to be more successful, be happier? Tell us about the day in your life.
First of all, not enough sports, unfortunately, these days. My partner, wife, and I are like talking about the fact that we need to do more early in the morning before the kids are being sent to school. My 2 sons are playing sports. They're doing sports, and I'm very happy and I'm very proud. But it's, I think that's something that really, basically, the more you're busy, the more you can get being squeezed in your day-to-day. We have calls in Sanara, from all over, not just the US, the Europe, Asia. Sometimes it could be late at night. Sometimes it's quite early in the morning while everybody is awake in China or everybody is awake in Japan. So it's truly enjoyable, I have to say. One care making sure that we get the best deal flow our exposure, participating in conferences, in many of which I do participate on one side, and making sure that we are exposed to opportunities and exposed to bring value to the companies and get to know more strategic players and more investors that can co-invest with us. So this is on one side, on the deal flow side. On the other, on the portfolio management of Sanara, is a lot of work with entrepreneurs, with CEOs, such as your podcast. This is like truly delicately conveying a message of something which they do differently, and not to hurt their ego, not to hurt their personality, but rather to teach them something without them being, bothered with the fact that the chairman or the board member has instructed them to do such and such, to the extent that is possible, of course. So my day-to-day is a lot of phone calls with entrepreneurs, with CEOs of companies, with deal flow, with strategic players. Quite exciting, I have to say. This is a healthcare innovation. It's very, very exciting, day in, day out, and night in, nights out.
Yeah, but also quite challenging, right? Like, how do you survive that marathon, that long marathon till you get the exit?
So first of all, while building up those companies, you have certain milestones. Typically I would say getting an FDA approval, but this is not enough. Even though sometimes after 5 years you get an FDA approval, you're so very happy. And this is typical mainly to early stage investors. But sometimes it's like a puzzle. You bring in one piece, you bring a good CEO, then you bring another, $3 or $4 million to that company, and then you bring an advisory board member, which is truly a KOL, a global speaker, and someone from within the industry as a co-chairman of that company. It's taking the pieces, and it's like a puzzle that you build, and then you take it to the next level. So that, even before an exit, that's a truly satisfying, even before an exit, because you see a company progressing and then stepping into the marketplace and starting to sell and increasing from 2 millions to 4 millions and doubling and seeing a future. And then you talk about an exit. I hope that we should have, 1 or 2 of our exits coming up in the next 18 months. I hope so. And then that will basically will be a trigger for a few others to come. We do have some of our companies which we believe could be very interesting companies and very big exits. I've mentioned 2 on the digital health. I can mention 2 on the bioconvergence side, biology converging into deep tech. One of which is a company called nanodrops. These are drops in your eyes to replace lenses and glasses. Of course, a very simple procedure, not a laser surgery, rather a laser flash, creating a pattern on your cornea. You're putting a drop, you're good to go with no glasses, no lenses for 4 or 5 months, or potentially even for 2 or 3 years, depends on the particles that we decide to put in. But it's very easy process, something that we're looking and very excited to see becoming commercial. Not yet, but it will, hopefully. So this, by the way, could be a very big exit on one side. And another example of bioconvergent investment, which we like, is a company called Discio. That brings me back to my days of being an athlete, a professional athlete. But so many people suffer, and go back to a question, Charles, at the beginning: what do you invest and why do you invest in healthcare? So many people, 80% of the population globally, suffering from back pains, right? And in so many cases, they need to go either through a physiotherapy or eventually they may go to a surgery. And in so many cases, one of the main reasons for that to happen is basically your disc in the back, they do shrink and they get dried out with no liquids. So actually, Discio, one of our companies that we invested in, alongside a French VC Supernova from Paris and a Bold Capital from San Francisco, we co-invested in a company that basically puts a needle into the disc with a tiny device that resides on the skin, and basically sending manipulations, electrical manipulation through the disc and creating again the pumping mechanism and allowing the liquids to go back into the disc. While instead of shrinking and getting dry, they actually get the liquids back and avoid back pain. So nothing like that we have seen worldwide, unfortunately. And hopefully this will come up to the marketplace in hopefully in 2 years or 3 years times, but it's something that we truly like to support, and we see a lot of potential. And the fact that we just did 10 cases now in Calgary, in Canada, where are you coming from, in Canada? And the results are very interesting on one side, but on the other, it's the ability to change lives of people instead of going through a surgery. And those who've been suffering from back pains, major back pains, know exactly what I'm talking about. If we're able to do such a minimal invasive process and help millions of people worldwide, it will be both an exit and a very satisfying investment, regardless to the exit, if and when one day.
Yeah, let's keep touch on that and see how that one goes. Where can people find out more about you, Assaf?
First of all, our website on Sanara, Sanara Capital, LinkedIn, Sanara and myself on LinkedIn, and quite a bit traveling and participating in conferences and pushing innovation, not to give up on innovation in a very conservative market in healthcare. So I'm participating in Europe now. I'm heading in 2 or 3 weeks' time to the LSI in Singapore, taking place. First time that the LSI group is doing one also in Asia. So I'm speaking and talking to many strategics and investors and conferences, and more than happy to to support and to provide value to whoever is interested in healthcare innovation. This is so crucial.
Yeah, thanks for being on today, Assaf. That was Assaf